I'm Dr. Janet Gordon-Palm, DVM, Certified Veterinary Chiropractitioner. I'm an integrative medicine veterinarian, and I've been in practice for 40 years and practicing integrative medicine for 11 of those 40 years. And in that period of time, I've been able to combine the best of alternative therapies with conventional therapies. When we combine non-invasive ways to activate the body's own healing pathways, we can actually minimize the amount of pharmaceuticals that we're using on those animals and hopefully expedite healing in a more sustainable way. I took this course in cold laser therapy back in 2010, and that is using a non-thermal visible light wavelength light therapy device or laser therapy device. They've been using this technology in human athletes for 30 years. Sports teams all have access to non-thermal laser therapy. A lot of the sports teams are advising lasering before an adjustment. So I've actually started doing that because when the muscles are calmed down and the spasms are reduced, it's more effective of an adjustment. You actually hold the adjustment longer. So I take a lot of some of the things I hear from some of the speakers for the laser in the human sports medicine field and apply that to some of my animal patients. Another thing we can do with the laser is we can laser active scar tissue. And when I heard a sports performance practitioner talking about lasering with the violet red laser some of the active scar tissue, I think about, well, what are we doing with spaying and neutering dogs and cats? We've got scar tissue there. What are we doing when we geld horses? We've got scar tissue and maybe adhesions there. So I started to incorporate with my violet red laser. I will actually laser up into the inguinal area on either side, helping to improve the nerve communication in some of the areas that might have scar tissue or adhesions. When I saw the responses that I was getting through the use of this tool, when I heard fellow people in the, fellow attendees in the coursework talk about their patients, there were a lot of chiropractors, a lot of human physicians that were in this course, there were a lot of veterinarians, and everyone was talking about some of the dramatic changes that they were seeing in osteoarthritis, in neuropathies, in healing tissues. I thought, gosh, I've got to have this. And so I leased it, brought it home, and with my husband having some degenerative changes, I thought if I didn't try this on him and have this be beneficial for his health and well-being, then I'd be missing out. So I used this on my husband, and within two 2-minute sessions on him, his back pain went from 8 out of 10 to 2 out of 10. I just started crying. I thought, this is the direction I have to go. So I wondered, does this work as well on all my cases? A common way that I use the laser on him, and here's my handheld laser. I'll often laser at the pole. And then I'll come down the cervical vertebrae, which runs along this area here. And you might be able to see the vibrations. I've got different settings in the laser that are increasing circulation, lymphatic drainage, as well as decreasing pain and inflammation. So I'll go along the spine. We can go along the thoracic vertebrae, down the thoracic and lumbar vertebrae, over the croup. In my small animal and equine cases, we were seeing animals who were going upstairs after 1 or 2 treatments that hadn't gone upstairs for a couple years. These are old arthritic dogs. We saw kitties doing the same thing, jumping up on surfaces that they hadn't jumped up on in months or years. And I kept thinking, this is incredible. And I wondered if it would work on other species. I worked on some horses, saw some pretty good responses on healing tissue. So Maria seemed to come in one day with a laceration over her tendon, and it was full thickness, probably about 1.5 centimeters by maybe about 1 centimeter. and unknown cause, you know how those happen. And so she had some hemorrhage, looked like arterioles were bleeding a bit, but nothing real major, and her tendon looked good, she was not lame. So the decision, yes, it probably could have supported a couple sutures. However, the nice thing about horses and healing and this particular laser is we don't always need sutures, and especially if it's nice and clean. And so now what I'm using is my Erconia Class 2 non-thermal lasers. And the nice thing about that is there's no heat that's causing any collateral damage, because heat can sometimes affect the tissue, not just with a thermal burn, but also at the level of the DNA. So you want to make sure that you're not causing any problems. And so with the properties of laser, having focused light that actually activates healing pathways, resulting in increased ATP, which is fuel for the cell, as well as different changes in the skin that can actually increase the healing cascade, we can actually help to speed healing. And studies are showing 40% faster healing on lasered versus controls. So we use that benefit. So this is day 2 after her injury, and we're going to go ahead and laser her probably again in the next day or 2. But she had a laser initially. She had the day off yesterday with a bandage, a support bandage on it, and now today probably just a lighter wrap is all she'll need just to keep it protected. I thought, well, gosh, does this work in exotic cats? These poor cats have been declawed, they've been sideshows, they've been in zoos, they've got geriatric issues. So I volunteered 1 day a week for 4 weeks, and I treated Bengal tigers, I treated African lions, I treated servals, I treated cougars. But there was one Bengal tiger that was really amazing, a tiger named Zeus. And Zeus had been lame for a month, and he'd been on some medication, wasn't really improving, so his rear leg lameness was not improving. He was getting a little bit worse. They were going to sedate him and take him to the University of Minnesota. So I was up there treating other animals anyway, and so I offered to treat him. I treated his entire spine and the leg that he was lame with a whole list of differentials. It could be back pain, it could be a stifle injury, it could be sprain or strain. So all these different differentials entered into my thought process, so I treated for all of them. And so he was walking back and forth, because in the sports teams, they recommend that they be treated in a range of motion. So when an animal is moving around and you can treat them from a distance, the properties of a laser is such where the energy of those beams stay pretty constant for a distance. And these beams are parallel. And so you can actually cover an entire spine, you can cover an entire leg. And so as this tiger was walking back and forth, I was treating his spine, I was treating his leg that he was lame on, and did 2 treatments, 90 minutes apart, went away, came back the next week, and they told me that after that series of treatments I did that day, the next day he was almost completely better. Well, you know, you think, oh, is this a magic wand? No. What it did was it probably decreased a muscle spasm. He probably had sciatica, because an ACL injury wouldn't heal in one treatment. A fracture, of course, wouldn't. But we were able to show them that there was some responses there. And I always tell people too, when you're looking at a holistic situation, you don't zero in on just a lame area. You don't zero in on a certain posture. You look at the whole animal and the fact that they can compensate for different injuries or discomfort. When you look at putting all these modalities together, rehabilitating at the spinal level, at the connective tissue level, at the cellular level, speeding all that up with the laser, then you have a chance for potentially healing an animal and resolving issues rather than putting a Band-Aid on them. The whole world of quantum medicine is opening up for us, looking at the universe inside of us, inside of our cells. So energy medicine, quantum medicine, if you will, that's the healing of the future. And that's what lights me up, pun intended.